This is another edition of our clinicians' illusions. This is the way clinicians get fooled, thinking errors that they make that lead them to conclude that their school of therapy is the best. But there's other kind of thinking errors that therapists make that can cause problems as well. And I call that reverse hypnosis. And reverse hypnosis is when the patient hypnotizes the therapist. Now, we all know that a lot of therapists do hypnosis, which can be helpful, like for smoking. You can have a hypnotic session with an expert in hypnosis for smoking, and that's how I actually stopped smoking when I was a medical student. We had a group hypnosis session, and just to demonstrate to us how hypnosis works. And he had us like closing our eyes and wiggling our fingers for a yes or a no. And do you have some habit? And are you ready to get rid of it? Or do you want to get rid of it now? Or wait a couple of weeks? Or, that type of thing. And I was smoking a pack of these Indonesian cigarettes that smelled so great. But after that session, I just never smoked another cigarette. But I'm talking about hypnosis that goes in the other direction, and there's 4 kinds of reverse hypnosis. The first is when you have a new patient or an existing patient who's severely depressed. The patient will nearly always have the belief that they're hopeless and worthless. And I can tell you, depression is the main thing I've treated because my book, Feeling Good, brought depressed people from all over the world to Philadelphia to see me because of that book. And reverse hypnosis of someone who's depressed is when they hypnotize you into believing, yes, they really are worthless and hopeless. And that's a tragedy because once the therapist buys into that, this patient really is kind of hopeless, the therapist gives up, and then it becomes a self-fulfilling prophecy. And I don't think I've ever had a patient who came to me who was severely depressed and anxious who didn't convince me that they really are worthless and hopeless. Every time I succumb to the trance and I think, this person, I think, might really be worthless and hopeless. And then after a couple of weeks, I began to see through it, see they've got a lot of distorted thoughts. We help them change the way they're thinking, and all of a sudden they've recovered and they're feeling joy and happiness. And the second form of reverse hypnosis is the anxiety reverse hypnosis. Now, I use 4 major approaches in treating anxiety, 4 completely different ways that you can overcome anxiety, fears, phobias, panic attacks, and so forth. And I use 4 different ones because if you only do one kind of technique, you'll have some patients recover, but not all patients recover. And I want all my patients to recover and to recover completely. I've had 17 different kinds of anxiety myself. I've mentioned this on other videos. And so I love treating anxiety. But every person who's anxious must be willing to confront your worst fear. That's called exposure therapy in order to get over the anxiety. And that's something that no anxious patient wants to do. If you're afraid of heights, you're going to have to maybe go up and down in a glass elevator if that terrifies you until the fear disappears. Or if you had a terrible trauma in the past, I might ask you to fantasize that trauma and make yourself as anxious as possible. Get your anxiety up to 100% by just remembering it and making it as awful as it can be and keeping it as high as possible for as long as possible. And if you do that, in most, if not all cases, the anxiety will eventually peter off and go down to 0. And that's incredibly important for any type of anxiety. Well, here's what the reverse hypnosis is. The patient convinces the doctor that they're not ready for exposure, or that it would be too much for them, or can't I talk about my childhood? and why I am so anxious, but I don't think I'm ready yet, or I really want to do the exposure. And patients are so successful at hypnotizing their therapists that only roughly 20 or 25% of the therapists in the United States use exposure in their treatment of patients with anxiety disorders, because the therapists have been hypnotized into believing that exposure is too dangerous, or the patient is too fragile, or they'll have a psychotic episode, or they'll commit suicide or something if I use exposure. And I think it's sad. I've used exposure for 45 years with patients, and I've had over 4,000 hours working with patients with severe depression and anxiety. And I've never had a problem with exposure, but it requires therapist skill to do it properly, to make sure you have the patient's agreement, and to be firm with the patient that this is one of the techniques we're going to use to help you completely get over your anxiety. And we're going to settle for nothing short of a complete elimination of your symptoms. Another incredibly important form of reverse hypnosis, and that's when you're working with a patient and they suddenly start talking about somebody that they're not getting along with. And you're thinking about, well, maybe this person would like some relationship therapy, or learn to use the 5 secrets of effective communication, or do something to improve that relationship. And I would say that at least 80% of the time, the patient is convinced and hypnotizes the therapist to become convinced that they're the innocent victim of the other person's bad behavior. Like my wife just nags me all the time, or my husband never listens, or my brother keeps, doing blah, blah, blah all the time, or my neighbor keeps doing blah, blah, blah. And they almost never are interested in looking at their own role in the problem, or looking to change themselves. And that's reverse hypnosis. They're trying hard to convince you, the therapist, that they're not to blame. The other person is to blame. And the problem with that is that the work I do, whoever's in the room with me, I want them to pinpoint your own role in the problem and work on changing yourself, because the moment you do, the other person will change. Well, what's the fourth and final type of reverse hypnosis? And that's for habits and addictions. Like let's say you have procrastination and you go to the therapist, and the therapist, you say, I need some help with my procrastination. I'm just not motivated, and I keep putting things off, and I tell myself tomorrow will be a better day. Or it could be your habit or addiction might be chewing your nails, or overeating, or drinking too much, or whatever. And the hypnosis, that the trance the therapist falls into, is the trance of thinking it's their job to help you. And so they start suggesting all these things you can do that would help. And then the patient says, oh, I tried that, and that won't work. And I tried that, and that doesn't work. And whatever the therapist does to try to help, the patient sabotages it. And the error that the therapist is making on habits and addictions is the most common therapeutic error of all. It's trying to help someone without looking at the subconscious and conscious reasons that keep the person addicted. And there's 2 powerful motivational factors going on there. Number one, I did a research study at the Stanford Hospital on habits and addictions. It was the same study that I measured 178 newly admitted patients, and I got diagnostic rundowns on all of them. For 60 diagnoses we made according to strict DSM criteria. So I had all of the addictions, all the eating disorders, gambling, alcohol, drugs, all that kind of stuff. And then all the emotional problems, depression and anxiety and loneliness and all the anxiety disorders, the personality disorders. And I was trying to figure out what is the emotion that most commonly triggers addictions. And I'll give you a multiple choice test, and you can tell me what you think the answer is. The first answer, the multiple choice, that the emotion that most commonly triggers addictions is depression. How many of you think it's depression? And then option B would be loneliness, not having a loving partner, and so like you eat to fill the hole in your heart. And then another option would be the anxiety disorders like panic attacks and social anxiety and things of that nature. And the final one would be the personality disorders, like dependent personality disorder or compulsive personality disorders. Which of these do you think ended up having a overwhelming causal effect on addictions, like drug addiction, alcohol addiction, food addiction, gambling, and so forth? I forgot to mention the last one, which was low self-esteem. So now make your choice. It's either depression, loneliness, anxiety, personality disorders, or low self-esteem. Which one do you think had the big impact? Are you ready for the answer? Okay. If you thought it was anxiety, let's raise your hands. Or depression. If you think it was depression, raise your hands. Okay, I see a lot of hands going up, but it wasn't depression. How about loneliness? How many of you would say loneliness leads to habits and addictions? A lot of hands going up, a few anyway. That's not correct. How many of you think anxiety disorders? Yeah, okay. A lot of hands went up there, but no, that wasn't it. How about personality disorders? No, that wasn't it. And what's the last one we came up with? Oh, yeah, self-esteem. How many of you think it's low self-esteem? Yeah. No, had no causal effect. None of these things were associated really with any habits or addictions. The only thing that was associated with it was a test I developed called the temptations test. And it just asked people, how much have you been struggling with the temptations to use or to overeat or whatever it is in the past week? And that was overwhelmingly associated with the addictions. The mood problems were associated with overeating, but in the opposite direction. The more depressed people were, the less they were binging and overeating, and the less they weighed. So what really taught me is that, the reason people get into habits and addictions, you know why people drink and overeat? Because it's fun to drink, to get stoned, to overeat. It's fun to eat. And we didn't have obesity in the 1850s in the United States. You know why? Because we didn't have all this delicious McDonald's and all this food available and all the money to buy all this delicious food. And it's really, we have addictions because we want that addiction to make us feel good. And in addition, the alternative, giving up the addiction, it seems like discipline and deprivation. And you, in order to treat any addiction, you have to bring those powerful motivations to conscious awareness and then negotiate with the patient. Are you sure you're ready and willing to give up these fantastic temptations? So the error that clinicians make is thinking the habit or addiction is some kind of problem the patient wants help with. Do you know how many people in the United States who overeat? If I ask you right now, how many of you would like to lose some weight? Put your hands up. Okay, I see an awful lot of you put your hands up. And you just made a lie. You do not want to lose weight. Give me an effing break. Losing weight sucks, and I'll tell you why. There's two ways you can lose weight. Stop eating all that wonderful food you love and get out and exercise even when it's crappy outside. Now, how many of you want to give up your delicious food? I didn't think so. How many of you are yearning just to get out there when it's rainy and snow and icy and cold? And yeah, I didn't think so either. So that's the whole scoop. And we have new tools for helping people with habits and addictions that focus on reducing those powerful motivators. But that's the whole ball of wax with habits and addictions. We have them because we want to have them. Okay, so I want to just give you a quick summary of the 4 kinds of reverse hypnosis. For depression and anxiety, for depression, the person will try to hypnotize you that they're worthless and hopeless, and that's never true. But they'll really try to get you to buy into that. For anxiety, the reverse hypnosis is they'll try to get you to believe that they can't use exposure, they shouldn't have to use exposure, it's not helpful to use exposure. And if you give in to that, if you're a therapist or a friend, you rob them of the opportunity to get over their anxiety. For relationship problems, the reverse hypnosis is the most powerful and subtle and insidious of all. The person who's having a conflict with someone, whether they're their spouse, a friend, a stranger, whatever, they will try to convince you that it's the other person's fault and that they're the innocent victim. And if you give into that, they're doomed in terms of making that relationship problem better, because they're going to have to look at their own role to improve it. And then for habits and addictions, the reverse hypnosis is like if it's procrastination or overeating or over drinking, the reverse hypnosis is thinking that you're going to save them or help them or rescue them with some trick or technique or method. And you'll be overlooking the powerful role of motivation, because people have habits and addictions, procrastination, drinking, whatever it is, because we want to do those things. And unless you know how to address that resistance and lower that resistance, you're not going to be very effective in working with people with habits and addictions. That's all for now. Thanks for watching. Hope you like the summary. Hope you like the video. So, bye-bye.